My genomics learning journey started straight out of school when I decided to undertake a BSc in genetics, as at 18 years old I thought it seemed pretty interesting. In my final year I studied a module in epigenetics. There was one particular lecture exploring how environmental factors like smoking could impact genetic predisposition to disease in the mother, the fetus, and even the eggs of a female fetus. I can still remember feeling completely astounded that the environment in pregnancy could influence the genetic health of the mother, her baby, and even her grandchildren. And ever since that lecture, I knew I wanted to be a midwife. And since qualifying as a midwife, I've worked as a rotational midwife, a specialist screening and fetal medicine midwife, and now as the NIPT regional coordinator and lead genomic midwife for the Southeast GMS. I've been part of many, many incredible midwifery teams who are delivering genomics in maternity every day, from that basics of taking a family history to the implementation of routine genomic testing in NIPT. Last year, I started an NHSE-funded PG DIP in genomic medicine at the City of St George's. It's been really incredible to see how our knowledge and application of genomics in healthcare has expanded since I studied genetics 15 years ago. Undertaking the study has helped me understand not only how we are delivering genomics in maternity, but why it's so important. I believe that all midwives should embrace genomic educations to increase our confidence and to see how genomics fits across our practice. Ultimately, genomics has the power to improve care, choice, and outcomes for mother and baby. And I would urge every midwife to grab genomic learning opportunities with both hands, and then who knows where we'll be 15 years from now.
So hi, I'm Seb Pillon. I'm a GP in Bolton and an educator of GP trainees across the northwest of England. And I wanted to talk about genomics because I guess it's something that has crept up on me as a clinician, as an educator over the past decade. When I first learned about genomics as a GP trainee myself, it was sort of a space age kind of thing that I never really thought would impact my clinical practice. What I've seen over time, over the past 10 years or so, is things that were going to be kind of research led are now things that we use in practice and help patients. And of course, when I stop to think about things, genomics is everywhere. We all carry a family history. And when I'm in clinic, patients ask us about family history, inheritance patterns, and worries they have related to that. In terms of using genomics in practice, there are so many conditions that perhaps I hadn't even thought about, like cardiovascular disease or hemochromatosis that I come across all the time. Of course, general practice is where 90% of NHS contact happens. So it makes sense that we're at kind of the forefront of dealing with the practical applications of genomics. To make that easier, using resources like GeNotes have been so useful in helping me to understand the practical applications of things. It's one thing to read about the research and lab-based work, but it's another to understand how I'm going to communicate that with a patient in front of me that has none of the scientific knowledge or background that perhaps a researcher might do. I think we've gone from genomics being sort of a space age future kind of thing, something that we use in the here and now. And I'm really excited to see what happens in the rest of my career, given what's happened already.
Hello, I'm Siren Nazir and I'm the Paediatric Familial Hypercholesterolemia Specialist Nurse for the Northwest. I'm based at St Mary's Hospital in Manchester and I'm responsible for diagnosing and managing all children with suspected and confirmed FH that do reside throughout the whole of the Northwest. I qualified as a children's nurse in 2008. I studied at the University of Manchester and completed the Bachelor of Honours Nursing degree. And straight after qualifying, I started working as a staff nurse in Children's A&E at the Royal Manchester Children's Hospital. And then a year later, I decided to become a school nurse. So that was in 2010. for the same trust, Manchester University NHS Foundation Trust. And then after that, I then became working in genomics. So I started off as a staff nurse for genomic medicine at St Mary's Hospital. I was involved with managing the outpatient area, and quite gratefully became promoted to a metabolic specialist nurse just 18 months later. And it's ever since then I've been heavily involved with genomics and helping to manage and support children and families residing throughout the Northwest with rare metabolic genetic conditions. So I'd been a metabolic nurse for 10 years in total. And due to my knowledge and experience working within metabolics and genetics, I was a successful applicant for becoming the FH specialist nurse as of March 2024.
I started my cardiology consultant career in Stoke in 2011 as a cardiac electrophysiologist, looking after patients with heart rhythm disorders. Like most cardiac electrophysiologists, a small number of the patients I looked after had inherited cardiac conditions. In some patients, the cause was known, with long QT syndrome, Brugada syndrome, and hypertrophic cardiomyopathy being prominent. In other patients, there appeared to be a familial link, but the cause was unknown to us. It became clear to me after a few years that I needed to improve my knowledge to offer the best care to all our patients, and we needed the support and education of a genetics team. And luckily for us, Professor Bill Newman and Kay Metcalf in Manchester kindly agreed to take part in a bi-monthly video MDT with our team in Stoke. This had a big impact on the care we offered to patients with familial conditions in Stoke, both by the support with individual cases, but also with the upskilling of our general genomics knowledge. In 2019, age 46, I decided to undertake a postgraduate certificate in genomic medicine at Manchester University, kindly supported by the Genomics Education Programme. I was keen to understand more about genomics, as it appeared to me that many of the unanswered questions regarding my patients and their families lay within the human genome. I loved the course, kindling in me a desire to learn more, and a year later I signed on for the full MSc, again supported by the Genomics Education Programme. Whilst I'm not an infectious diseases expert, it was fascinating studying the infectious diseases module online in the summer of 2020, just a few months after the start of the COVID-19 pandemic, with our lecturers tilting the module towards the virus. In March 2023, I moved to Manchester as a dedicated inherited cardiac conditions consultant, leading a team of 8 consultants in Manchester. My learning still continues on a daily basis, this time via conversations with colleagues both in cardiology and genomics. The developments in genomics during my 14 years as a consultant have been rapid and at times dizzying. However, these developments offer the chance of a step change in care for many of my patients, and it will be key that we continue to upskill the healthcare workforce if our patients are to derive the benefits that genomics has and will have to offer in the future.
I've been working as a pharmacist in the NHS for 30 years, during which time I have seen significant change in the way that healthcare is delivered. For me, one of the most exciting recent developments is the use of pharmacogenomics, which looks at an individual's genome to determine how they might respond to specific drugs. This approach replaces a standard trial and error approach with precision medicine to ensure that the right treatment is given from the outset without unnecessary unpleasant side effects. I first developed a passion for genomics after attending a pharmacogenomics lunch and learn session in 2023, led by Lucy Galloway, who is the consultant pharmacist for genomic medicine for the South East Genomic Medicine Service. In September 2023, I successfully applied for an NHS England funded postgraduate certificate in genomic medicine at St George's University of London, which I completed in March 24. The certificate consisted of 4 taught modules, each of 1 week face-to-face training, which gave me the opportunity to meet fellow students from a variety of backgrounds. My cohort consisted of many different healthcare professionals, including consultants, GPs, nurses, pharmacists, and genetic counsellors, as well as students who had just graduated, which provided a great opportunity for us all to share our experiences and support each other in our learning. Although I was one of the oldest in our group, I was very pleased to find that my brain cells did still work and that I achieved high marks in each of my exams and assessments. After completing my postgrad certificate, I was keen to put my learning into practice to the benefit of our patients, and I started a new role working 1 day a week as a lead pharmacist for genomic medicine for Surrey Heartlands ICB. This role was introduced to support the delivery of NHS England's genomic strategy across Surrey. Then in January 25, I started a 6-month secondment as a pharmacy genomics intern, working 1 day a week with the South East Genomic Medicine Service. I thoroughly enjoyed this role as it provided the opportunity for me to work closely with the GMS on several projects, including supporting the CYP2C19 clopidogrel pilot at St George's Hospital, working with the clinical genetics team at St George's Hospital to develop patient information leaflets for patients and relatives of those patients who are found to carry an MT-RNR1 variant, increasing the risk of aminoglycoside-induced toxicity, and the development of a regional position statement to highlight the importance of a dedicated pharmacy resource for genomics across a system to ensure implementation of pharmacogenomics into local pathways. I am very excited to see that genomics features heavily in the NHS 10-year plan, and there is still so much opportunity for me to learn about this rapidly expanding area. I'm really looking forward to what the future holds for genomics and being part of this exciting journey.
I'm Jude Hayward. I'm a GP and I've worked in Bradford for a number of years. I've also worked in clinical genetics for a number of years as well. I don't really remember when my genomics journey started. I've always been interested in genetics and genomics and inherited conditions. I think probably because it just fascinates me how personal it is to people when something runs in the family, what it means for them and for their identity. So I became interested in family history right from the beginning, very soon after I qualified as a GP. And I think that's a really key point to make, is that most people in general practice don't realise that they've been doing genomics for a very long time. For a very long time in primary care, we have been identifying people through family histories who may have a higher risk of developing certain conditions such as cancer, or who may have a condition running in the family and need support when they're thinking about how to have a family, or they may have symptoms themselves of a particular condition. And really our role in primary care has always been to talk to people, ask them about the family, and then facilitate onward referral if that is something, if they are somebody or their family who may benefit from onward referral to clinical genetics. So I was really fortunate about 20 years ago, an opportunity came up to train within clinical genetics and become what was called then a GP with a special interest, a GPSI. And I've been working in clinical genetics ever since, helping to care for patients who have got a family history of cancer, who may be eligible for genetic testing for an inherited cancer predisposition, and certain conditions such as neurofibromatosis type 1. And as I said, really quite early in my journey, I became aware that most colleagues in primary care aren't aware that they've been doing genomics for a very long time. And so I started doing some educational sessions, I started teaching, and people asked more and more for me to write things and to deliver events, because I really sort of translated it into cases that they see in their everyday practice. And really that's grown and grown, and over the years I have now worked for the NHS England Genomics Education Programme as their primary care lead for a number of years, again continuing to just help colleagues to become aware of when genomics does present in their practice, help support them with the knowledge that they absolutely need in order to deliver care to their patients, but also to strip it back and remove any complexity that they don't need in order to deliver that care. So I really can't pass up an opportunity to talk about the resource that we've been developing for a number of years in the genomics education programme called GeNotes. There is a primary care suite of resources. It is based on patients, on real clinical scenarios. They are very brief. They've been written by GPs for primary care. And we've had really good feedback about how concise and useful they are. So if you have a minute this week when you're having your cup of tea, or if you do manage to grab a cup of tea in primary care, have a look at GeNotes, and you will see patients there. You will see patients within those scenarios that you see every day in your surgeries. Over the years, I then had the chance to go through the Masters in Genomic Medicine when I realised that things were changing at a rapid pace. Genomics was taking over, there were more technologies, it was going to be able to contribute to more areas of clinical care. So I went through the Masters in Genomic Medicine, and again through that realised that there were a lot of primary care colleagues who were doing similar and weren't really sure how to take that forward or continue their learning or use their expertise afterwards. So since then, I've moved more into innovation, and this has just really enabled me to carry on the journey, discovering more about genomics, which is important for primary care. And really the areas of big impact that are coming to us in primary care are the use of genomics in prescribing to help us ensure that we are prescribing the right medication for our patients at the right dose. And hot on its heels also is the field of integrated risk scores. So using information about genomics to help predict risk for certain chronic conditions such as cardiovascular disease. So genomics is here. We are using it in primary care. We have been using it for years. And really, we will just continue to do what we've always done. We will talk to people about their family history. We will identify symptoms, and we will talk to people about risk of particular conditions. And increasingly, we will start to use it in prescribing decisions as well. So I hope I've inspired you today. It really is here. Please go and have a look at GeNotes, and you will see patients that you see every day in your surgery. Thank you.